style is what we would love to shift our clients to, right? To more of a secure attachment, right? That I can depend on others, but also on myself. So I can do both. In fact, I can choose when to go to another person to look for that reassurance, look for that comfort, and also the ability to also self-soothe and comfort myself too. I can do both, right? And anxiety is expressed like typical. They still have anxiety. It's not that they don't, right? So even if you do amazing EFT work with people with anxiety issue, it's not like suddenly all the anxiety disappeared. It's not like that, right? Obviously, they still have it, but they're much more regulated. They can self-soothe now. And probably the occurrence of those episodes are a lot less than before. And even when they do happen, they have more abilities now to self-soothe without always get into like a lot of this reactive explosion. So that's what we would like to shift people to, right? To that. They can name and soothe anxiety without excessive shame or avoidance. They can seek support appropriately while still maintaining this self-agency that I can still, take care of myself in that way. Okay? Any questions around the attachment style before I move on, folks? I just want to give you a bit of that lens, right? Looking at anxiety through that attachment lens, right? As before we jump into actually looking at the EFIT piece, because our model in EFT is very much centered around attachment. Okay?
I have
No
a question.
questions? Yeah,
I have a
go ahead.
question. So, do you engage in any kind of somatic work with them? And if you do, what?
Do we do any somatic work, did you say?
Yeah.
Yeah. So if you are a pure EFT therapist, you don't typically do somatic work. But we will use the somatic experiences to track their emotion. We do that. So we oftentimes ask about the body responses, right? But I also have colleagues who combine somatic work with EFT. They do amazing work too. So you can certainly combine the two. It's highly integrative, right? But from a pure EFT perspective, we don't typically like do a lot of somatic work. I would say except just to do enough to help people to stay within the window tolerance. If they start to disassociate, they start to go outside too much, yes, we might do some somatic work, right? But it's not our main move, okay? Unless you integrate like somatic work, then yeah, you certainly can do that. Okay.
Thank you.
Yeah. Okay. Now I'm going to move on then. Now, but obviously, right, not all anxiety is about attachment, right? Not directly anyway, right? Not all anxiety that we see in our office is always like attachment based, right? Things like biological anxiety, like arena, like generalized anxiety that begins in childhood despite a secure relationship. We've seen that, right? So even though they're very secure attachment in their childhood, but yet they could still biologically they have this component about them, right? Or medical,